The aims of the activity were to create a framework that would engage students in hybrid active learning to develop and apply their clinical skills in the absence of patient contact. To do this, we decided to simulate patient management through case-based scenarios in preparation for the resumption of patient care provision using customized high-fidelity training models. We also wanted to promote reflective practice and goal setting through the use of an e-portfolio in order to enhance student autonomous self-regulation. To meet these aims for our senior undergraduate dental students in their 4th and 5th year of study, we developed a series of simulated patient cases consisting of preclinical activities, which students completed at home, timetabled simulated clinical sessions, and post-clinical activities. Initially, students were presented with a simulated patient, including a detailed medical history and presenting complaint. This was supplemented with details of the clinical presentation and accompanying images. Students then went on to interpret radiographs, allocated the patient to a disease risk category, and formulated diagnoses and a treatment care plan. Once the preclinical activities were complete, the students accessed a video where an experienced clinician talked through the case, including the risks and benefits of possible treatment options. Students then reflected on their own performance in relation to the areas raised in the case discussion video and were timetabled for simulated clinical sessions in clinical areas, where they undertook practical activities in relation to the simulated clinical case, under the supervision of a tutor who provided appropriate feedback verbally and using LiftUp, the developmental software used within the school. Upon completing the simulated patient case, the students were able to review this feedback and, through reflective practice, able to identify areas for development. The common thread which followed students throughout the simulated patient cases was the e-portfolio. Developed in close union with our colleagues from the TEL team, the platform of PebblePad was selected as this was easily accessible to students at home, in clinical areas, and on mobile devices. This helps to satisfy the Liverpool hallmarks of active learning, authentic assessment, as students are completing exercises that they would be expected of them every day during their clinical practice, and digital fluency. This was also used for the reflective elements of the approach, with a goal-setting template available to students. Now, to try and bring the simulated patient case to life, we utilised our in-house 3D printing facilities. As we can see in the image on the left, we have an X-ray or radiograph of a patient with multiple cavities in their teeth highlighted by the red circles. These were replicated in terms of size and shape in the 3D rendering on the next image. After printing and processing, the voids within the tooth were packed with a soft material to replicate the soft decay found in cavities such as these. And in the image on the far right, we can see 2 3D printed teeth in situ. During the simulated clinical sessions, students worked in clinical areas wearing the personal protective equipment they would be expected to wear as if treating a patient. The models were mounted in a phantom head, which you can see here on the image on the left, secured to the dental chair. To try and make the experience as true to life as possible, replicas of the clinical paperwork used within the NHS Trust was used in digital format. During the simulated patient cases, we wanted to help students develop through reflective practice and goal setting in order to facilitate deliberate practice to aid further skill development. This thread began with the self-reflection on the preclinical activities, the simulated clinical sessions, and continued onto the post-clinical activities, all of which took place in the e-portfolio. To help aid this reflection, staff feedback was provided during the face-to-face simulated clinical sessions, which students could access at home. One of the reasons that this project worked was thanks to teamwork. We are very grateful to the TEL team that helped to develop the e-portfolio and our technical team who are able to 3D print the required elements. What was nice to see was that students were also keen to get involved. We met with student representatives throughout who suggested improvements which we could then implement to help enhance their experience. This approach was created with the Liverpool curriculum framework in mind, engaging students in active learning remotely through the e-portfolio, asynchronous videos, and practical tasks in clinical areas, reflective practice and goal setting, and authentic assessment by mirroring exercises they would be expected to undertake during their professional career. Digital fluency through the delivery across multiple digital platforms and digital communication. One area where this learning activity really proved to be beneficial to students was in the advancement of student confidence, which we'll talk about in more detail in a few moments. "89 students provided feedback on the simulated patient cases via an online questionnaire. This is just a sample of some of the questions asked. The first 5 questions relate to the learning support offered through the simulated patient cases, scoring highly for the development of clinical skills, also showing the students like the e-portfolio, and it helped them to identify areas for further development. The 4 questions at the bottom relate to student confidence in different clinical disciplines, with students agreeing they felt more confident in their skills after completing the simulated patient cases and feel able to apply them to a real-world situation. If we now look at some of the qualitative feedback received from students, we can see students found the activities to be well organised, and it helped them practice areas they wouldn't necessarily have practiced without this directed learning. Again, they fed back that they liked the PebblePad e-portfolio, and they enjoyed working through the simulated treatment plans from start to finish, as they would on a real-life patient. If we look at some more comments, we can see that the students feel more confident in their own abilities, with some now more confident in their clinical skills than they ever have been before. With one student saying the activities helped to build confidence and help them to understand the context of the treatment they were providing. Going forward, we would ideally like to replace the asynchronous case discussion video with a synchronous seminar to allow more two-way communication and facilitate discussion with students. We'd also like to have linked better with the academic advising meeting framework within the school to support students in their reflective practice and help them set realistic goals to aid their development. Another area we would like to develop further is the increased capacity and complexity of our in-house 3D printing capabilities to better replicate the different materials and layers that make up a natural tooth, to try and really bring the case alive for students. In the future, we would like to build a repository of cases that we could use both internally for our student development, but we also believe this has potential external applications for dental professionals through continual professional development, staff returning from career breaks, and helping those who are from overseas prepare for their registration examinations and get ready for life working in the NHS dental framework. We also believe this method of contextualised simulation through an e-portfolio can be applied to other subject areas such as medicine, nursing, pharmacy and allied health professionals, veterinary medicine and beyond the realm of healthcare in areas such as architecture, engineering and project management. Here is a list of some of the references we used to help develop this approach. Thank you very much for taking the time to watch this video and learn about this novel teaching approach. If you have any questions, please feel free to contact me on the email address on the bottom right-hand corner of the screen. Thank you.